All right, so I'm going to attempt to do the ostomy lab in 5 minutes or less. So what is an ostomy? It is a surgically created opening in the abdominal wall to pass urine or feces. So what are the different types of ostomies? The most common one is a colostomy. So what that is it has the name in it, colostomy, colon. So it's a surgical opening of the large intestine. And so there's different types of colostomies. So there's a sigmoid colostomy, which is going to be the most common, and that's going to have the most normal stool, the most formed. And then there's a descending. So if you guys remember with anatomy how when your stool would come down, it would first go ascending, transverse, then descending. So if you think about it, first ascending, that stool is not going to be fully formed because it's just starting out in that GI tract. So the ascending is going to be very liquidy. And then once it gets up here, it's going to start to form. So you're going to, in the transverse colostomy, the stool is unformed, but it's not pure liquid. And then as it goes to the descending, that's when you're going to see the stool semi-formed. So it's going to be the most resembling normal. So then you're going to have an ileostomy, which is a surgical opening from the small intestine. With that, you have to worry because patients might have a large amount of output, which is normal. So if that's on the test, that is considered normal for those patients. There's a urostomy, which is a diversion from the urinary bladder, urostomy, urinary. So that is for patients that have bladder cancer or spinal cord injuries, because if you think about it, they can't use their urinary pouch, so that they have to make that diversion for those kind of patients. And the most common type of urostomy is an ileoconduit, just something to know. So why do patients get ostomies? All right, for a colostomy, ileostomy, which is the most common, those are for people that have colorectal disease, IBD, remember inflammatory bowel disease, diverticulitis. And then for a urostomy, as I said, it's for patients that have bladder cancer or spinal injuries where, their bladder just will not work. So I included a little picture here of what the pouch might look like. So in a pouch, there's a flange, which is that circle there. And that is the part that goes over the stoma. The stoma is that red part that's kind of that opening from the surgical opening that passes the actual feces or urine. And 1 and 2 pieces are the most common for pouches. So they'll have 1 or 2 pieces on it. And you can add on a belt. It's literally just what it sounds like a normal belt for people that have a stoma that might be protracted. So it's kind of under the skin, I should say. So skincare, you want to use skin prep to avoid irritation. If your patient is having a lot of redness or irritation, you're gonna want to put powder on there, and then you're gonna put skin prep over the powder. That's like an adhesive. So it kind of helps with that irritation to make sure that peristomal, that's what the name of the skin around the ostomy is, will stay clean. And if there is any further problems, you're going to want to call a WOC nurse, which stands for a wound ostomy incontinence nurse. And so when you're putting on any stickers or any patches, you want to pull away from the skin, reduce irritation. And then problems with the skin can be irritant dermatitis, allergic contact dermatitis, or yeast infections, which is why you want to, with just a warm washcloth, clean that periostomy skin, whatever I called it. And then for diet, patients can have a regular diet, but some of the biggest complications, as I put in there, is odor, gas, flatulence, diarrhea. So with gas, you want to make sure that they avoid foods like asparagus, beans, eggs, garlic, onions, even some spices. And then for diarrhea, to stay away from foods that like chocolate, dried beans, fried foods, and highly spicy foods, and raw fruits and vegetables. And then My daughter's coming in. So really quick, you also want to use a Hollister sizing guide. Make sure you have a pouch that is going to be the right fit for your stoma to decrease irritation as well. That's 5 minutes. Thank you.